welcome to the fourth episode of MetLife Health Talk Show. This is Nancy Murad, and I'm the head of disease prevention and well-being at MetLife in the Gulf region. I'm having with me for this discussion the founder and the CEO of Slighter, Samer Al-Gharib, joining me from North Carolina. Samer is a digital health innovator in the space. We had the chance to meet in North Carolina recently. I was really fascinated with the innovation that he's working on in the area of smoking cessation. And I would love to pick his brain today about what's happening around the world in this space. Samer, hello and welcome to this discussion with me today. Maybe to talk a little bit about what's happening right now when it comes to COVID-19. What do we see in terms of correlation with smoking? Are we actually really being more aware and it's because it's the right time to quit? Are we really quitting or are we actually smoking more?
Hello, Nancy. Thank you very much. I'm glad to be here. I'm glad to be with you. And thank you for the great introduction. Actually, it's a great question to start with. So let me start with putting it like this. There is a lack of real-time data in the world, and this is why no one can know immediately whether people are smoking more now or are smoking less. According to some reports in Wall Street Journal, people are searching for more ways to quit smoking now within the pandemic, because you definitely know why. Because people want to become healthier, because smokers are more vulnerable to diseases like COVID-19. So there is some studies, and I'm joining next week a conference about the spread of the smoking now within the COVID-19, and probably we will get some data there. But there is some studies that they say that people under stress and under the stress of COVID-19, they are tending to smoke more, though they are searching for ways to quit.
That's a really interesting point. So there is, again, the intent and the awareness, which is one of the things that I would say COVID did the best to our health. So more awareness, maybe more challenges to actually take action. But I really love the point that you mentioned around, the inability of real time of having or the lack of having real time data in that sense. So I'm aware, though, on the other end, that this is something that you are doing with Slighter. But to be less technical and be more about, anyone who's listening to us, how can your solution help them reduce or quit smoking? Why did you start Slighter in the first place? And how does it fit into potentially any other solution that I know today on in terms of smoking cessation in the market?
Yeah, very well. Let's put it like that. Many efforts have been made so far to tackle this problem, and all existing approaches, if I may say, to solve the smoking solution are based on NRT, which is the nicotine replacement therapy. By substituting the problem and keeping the same challenge. It all started with me after I've tried everything on the market. Like I've tried nicotine patches, gum, inhaler, and I've tried even a medicine, a drug, and nothing worked very well. So I said to myself, we don't become smokers overnight. We train our brain by increasing the intake. And it happens that I noticed some research related to reduction, and what they say actually, and it's amazing. Reduction could reverse tobacco addiction and decrease the severity of withdrawal symptoms, and remove the barriers between the decision of the smoker to quit and the smoker. So I said to myself, why we don't have any tool? We live in the era of connected devices, big data, AI, machine learning. Why we don't have a device that learns our habit and coach us to reduce gradually again, like we started, until we reach to a point where we can quit or we can reduce the harm. And here is the birth of Slighter, if I may
Can we see it?
show you the device.
Amazing.
So this
How
is
does it work?
Slighter. Yeah, great. I just wanted to show you the finished product with the
Congrats.
touch
I saw
screen.
the more rough version earlier.
Yeah. So how does it work? In two words, Slighter learns the habit of the smoker for a period of a week as they smoke normally. We capture 50 data points from their habit. Why, when, where, their profile, their goal. And then starting the 8th day, we ask the smoker to set a goal, whether he wants to reduce to a certain point or he wants to quit completely. And then the nudges, the notifications starts to coach the smoker how to smoke again by replicating the same pattern. We repeat that by notifying the smoker that it's time for your cigarette. All what the smokers have to do is to follow the notifications, follow that new program of coaching. And by following that new program, we start to learn when they are conditioned and remove one cigarette at a time until they reach their goal. An example, if you smoke 20 cigarettes a day, within 1 week, we will give you, if you're following the program, 19, and then the other will give you 18 and 17 and so on until you reach your goal.
Oh, beautiful. Simon, I'm a big believer in, so you're trying to really to address a solution that is very complex. Where do you think the edge of technology is really when we speak of health innovation in general in terms of wellness? Today, you can go to the App Store. There are probably so, like in thousands, apps in terms of wellness. I'm sure there are at least dozens when it comes to smoking cessation. How do you
More than
see, and probably it's a growing field, how do you see people leveraging technology as an edge? Where is technology different than a human? Why should I have a technology versus talking to a person? Like, what's your sense on that?
Technology is driving the humanity to better solutions. We cannot deny how important is the fact uh, to um, to run or to walk every day. Um, Connecting that makes you aware of what you're doing. People like to quantify things. People like to collect things, and the history for us is what is giving us the thinking of the moment, and it's what is giving us the perspective of the future. Now I have my Apple Watch. Um, if I walk or I run one day, forgetting my Apple Watch at home, I feel like I didn't walk. Why? Because you didn't quantify this. Technology is driving human being to be more aware and to be keen to really get the best of their habits.
That is super cool. As you're speaking, I'm thinking of everyone who might be today smoking the non-lightable cigarette, right? So the heatable, the e-cigarettes. There's an emerging trend out there. Are you against the trend? How do you see yourself moving forward? What could be a solution for someone who, let's say, doesn't want to light a cigarette, who wants to have an e-cigarette? Could it be like a manual tracking? Do you have right now something, you have it on the roadmap? How do you look at that?
Slider is now targeting the ready-made cigarette market, people who smoke cigarettes or anything that needs a fire. This is why we say we are connecting the fires. It's Slighter is the IoT, Internet of Things, to connect fire. So anything now needs a fire to smoke, cigarillo, cigar, pipe, or cigarettes, or even rolled cigarettes. Slighter can help this market. Later on in our future plans, we're going to apply the algorithm and the AI to vaping and a heat cigarette. And this market is going to be easier because already the vaping and the e-cigarette has the battery, has the screen, has everything. So we can apply Slighter to all those machines.
Samuel, thank you very much. A really interesting solution. I think the way you're looking at the problem is very data driven, which is for the first time something happening like that. Very horizontal, so anyone can use it, irrespective of the other elements that they would like to complement a quitting approach with. Here, I would like also to personally recommend a book on that. So we spoke a lot about the behavioral. I'm a big fan of Alan Carr's Easy Ways to Quit Smoking. Really, a very good book. So really, it's this complementarity of doing the learning, of tracking yourself, how you're doing. How can someone get access to Slighter? Is it in the market today? And I know you have something special for us today for our viewers. So tell us a little bit more.
So Slighter is ready to be pre-ordered on our website, slighter.com, SLIGHTER.com, and you can see it on the screen. And we're actually doing a special discount for everyone that comes after MetLife, after you, Nancy, and after this episode. And they can see as well the discounted code. They can use it on our website. The delivery is...
Or they can go to the website and use it there. They would pre-order, and when is the expected shipment?
Exactly. So we are in the process of producing the device. So I'm gonna allow your viewers as well to see a very rare picture of the inner of the device. It's the bare bone device actually, and this is the device. So we're producing now. The shipment is gonna be within 4 to 6 months, as per the manufacturer, and we're gonna definitely keep our supporters posted, and we connect with them.
Thank you very much. I love your tagline: choose to reduce, and choose to quit. And really, you're highly encouraged to start today. I hope this brief discussion helped you start somewhere, even if it's from a small research online, or going to buying Slighter, or starting with a book in any way, shape, or form, to really kick that habit or that addiction once for all. Thanks, Samer.
Thanks a lot, Nancy. Thank you.